here at the headquarters of Africa CDC, and at the same time, I act as the acting head of division for surveillance and disease intelligence at Africa CDC. It is with great honor and privilege that I welcome all our distinguished guests and delegates to this inaugural conference of One Health for Africa CDC. We all know that for us to really be prepared for the next pandemic, we must take One Health serious, and Africa CDC is now in the process of ensuring that our whole approach to pandemic preparedness and outbreak preparedness has full One Health backing. Let me seize this opportunity to thank all that have taken so much of their time to ensure that this conference starts today. Initially, we wanted it to be face-to-face, however, because of the pandemic that is still ongoing, which is really stressing the need for us to continue to work very hard to be able
so I can bring it on.
to be able to control whatever Mother Nature throws at us as collectively as humans, and be able to control this kind of pandemic in the future. It gives me great honor again to welcome our most distinguished Deputy Director, Dr. Ahmed, who will give his speech and declare this conference open. Over to you, Dr. Ahmed, for your speech and to declare this our One Health conference open.
Thank you very much, Mohammed, and good morning, good afternoon, good evening, colleagues, wherever you're joining us from. It is really a pleasure to see so many of us participating at this inaugural conference of One Health, Africa CDC's One Health conference. I would like to really start by reflecting on where we are today. We are unable to meet physically because we are facing the COVID-19 pandemic. And we've been at this for almost 2 years now. This particular pathogen has claimed about 5 million lives globally now. And 4% of these are here on our continent of Africa. Let's also recall that this particular pathogen emerged from an animal reservoir. And this is really a very stark reminder to the importance of ensuring that One Health is ingrained in everything that we do, from preparedness to disease surveillance and prevention, and even to our response, because we are very tightly linked to not just the animal part of this globe, but also the environment in which we live in. As Africa CDC, we are very keen to see that One Health becomes the core of what we do in as far as preparedness and response for health security is concerned. And this is precisely because it is a transdisciplinary approach, and if we use it effectively, we are then able to make Africa safer, healthier for the people, safer and healthier for the animals and plants, safer and healthier for the environment in which we all share. One Health is not just important as a topic, but for Africa it is particularly key for it to be one of the drivers of safeguarding our health here on the continent. And this is because we are seeing increased urbanization. If you look at the population that were living in urban areas 10 years ago, the numbers have changed drastically. And with this pandemic, we expect that that will change even more. And in increased urbanization, it means that we engage with the environment differently. It means that we are going into deforestation to create more space. It means that we are actually walking into environments that human beings were not present in we have globalization. The ease of travel that we have today means that a pathogen appearing in one side of the world can very quickly be transported to another part of the world. And with the climate change, it means that those pathogens that had been secured within the Earth's system are now getting released into the air, and we as human beings and the animals which we live with are picking up these pathogens, and these are becoming outbreaks and even pandemics, as we have seen during this time. Secondly is we have an increased risk of emergence of new diseases and re-emergence of old ones because of the way in which we are engaging with the environment. And when the old ones re-emerge, Ebola is a good example, rabies is another example, and when new ones come in like COVID-19 and Marburg, it means that our environment of life as human beings, as animals, as plants, is also negatively affected. This means that a One Health approach is required to be able to address all these threats that come from zoonotic diseases, and indeed needs to address antimicrobial resistance as well, because of the pathogens, the way that they get transmitted from one population to another, from one species to another. We, as Africa CDC, recognize that zoonotic diseases, food safety, and antimicrobial resistance are the three key areas of greatest need of collaborative approach in as far as One Health is concerned on the continent. It's very important that we drive One Health using our priorities so that the results and the effect are going to be good for this continent. So those three areas are extremely important: zoonotic diseases, food safety, and antimicrobial resistance. We as Africa CDC, we endorse a One Health approach to address the shared health threats at the human, animal, and environment interface. And all this we are doing so that we can be able to have a safer and healthier Africa to contribute to Africa Union's Agenda 2063. As Africa CDC, we have done and continue to do quite a lot in this space of One Health. Some of the areas and initiatives that we've already developed and are implementing include the framework for One Health practice in national public health institutes. This is particularly important because it provides practical, evidence-based guidance for establishing One Health practices at the country level, particularly with the national public health institutes and the ministries of health. The beauty with this framework is that it can be easily adopted by other stakeholders so that it truly benefits a country, a region, and indeed the whole continent and the globe at large. This framework also provides a set of minimal objectives and proposed activities which are focused on One Health guidance. The framework also aligns with the Africa CDC strategic plan and the framework for establishing national public health institutes at country level. It focuses on several areas, and I will highlight only a few. One is the need to strengthen multisectoral coordination and collaboration with key stakeholders who are working within this space. It also focuses on developing and strengthening coordinated surveillance systems that will capture data from all aspects, not just human, but also animal and the environment. It focuses on strengthening laboratory systems and networks to ensure that we have early detection of any priority zoonotic disease that may come onto our shores here in Africa. It focuses on ensuring effective and coordinated public health emergency preparedness and response, and this is particularly important, especially when we have pathogens that can be spread quickly within a population, whether it is an animal population or a human population. It also focuses on strengthening and supporting One Health workforce development. And this is particularly critical because if we don't have the right workforce, then we are not able to provide the right training and preparedness for a country. This particular framework also informs the development of a wider Africa Union One Health framework that we hope with our other agencies within the Africa Union like AU, IBA, and other institutions we are going to develop in the coming year 2022. Some of the initiatives that we have co-developed with other partners include the African Common Position on AMR and the Africa Union Framework on AMR control using a One Health approach. And this is particularly important because we, as Africa CDC, are working very closely with other agencies of the Africa Union, with other organs of the Africa Union, indeed with partners that are working in this One Health space on the continent. We have also developed and are implementing event-based surveillance framework, which provides guidance for establishing event-based surveillance, for early warning, for risk assessment, for disease predictions and response by using this One Health approach. It is very important that we continue to expand our multi-sectoral laboratory training for diagnostics and quality management systems so that we can be able to tell whenever any pathogen is being consistently diagnosed in the laboratory across this continent and across the networks that we have at country and regional level. And that is why it is extremely important that we have established this inaugural conference on One Health, which brings together, I'm informed, over 2,000 participants from around the globe. We are very grateful that our speakers have made time to come and be with us over the next 3 days. And this represents the amazing One Health work that is being done, not just here on the continent, but also elsewhere, because we are keen to share knowledge and experiences from other parts of the world. We are also very focused that we want to prevent the next pandemic. We are very focused that to be able to do this, we must take action that is going to strengthen the way in which we coordinate our surveillance and the way in which we expand our diagnostic capacity on the continent. The African Union has portrayed itself as a true One Health leader. I must commend our colleagues from AU PANVAC, who during this pandemic season have supported COVID-19 testing for the Commission and also for our embassy staff who live here in Addis Ababa. This is a very clear indication of the One Health approach working in practice. On 2nd May of 2020, the AU PANVAC was commissioned and launched as the African Union COVID-19 diagnostic laboratory to scale up testing for SARS-CoV-2, the virus that causes COVID-19. And since that time, PANVAC has consistently delivered on testing for us at the Commission, as well as the embassies that are based here in Addis Ababa. This is One Health in action. It is therefore my pleasure to welcome all of you, delegates, whether you're from member states, whether you're from partners or other related institutions or even individuals. It's really my pleasure to officially welcome you to this inaugural One Health conference, and it is my singular honor to declare this meeting and this conference officially open. I thank you for your attention, and I'm really looking forward to the outcomes of this conference to strengthen Africa CDC's and Africa Union safeguarding of health in Africa. I thank you.
Thank you so much, Dr. Ahmed, for these excellent words of opening this conference. Let me inform everybody that we have over registration for this conference, and our deputy director just said the world should be safe for all. And what he meant by all is plants, animals, and environment. We track our One Health using 3 priorities, Dr. Ahmed said: zoonotic diseases, food safety, and AMR. He talked about very eloquently the Africa CDC framework for One Health practice in terms of strengthening the National Public Health Institution and Ministry of Health. And according to Dr. Ahmed, and according to Africa CDC, the whole of this framework can be adapted and used to develop the One Health concept for all the countries of the continent and even beyond. He said we must coordinate the surveillance and expand on our diagnostic capacity. One area that I'm particularly very pleased that our Deputy Director ended his speech on is the One Health approach that the African Union have used and set as an example. We have 3 different institutions of the African Union: the AU PAMPAC, Africa CDC, and the AU Medical Services, working together to ensure that we are able to provide highest level quality services for the African Union and all the embassy staff here at Addis Ababa.